2020.
Honourable Member for Christchurch East Central.
Good afternoon, Mr. Speaker. I rise to move this second reading of the Appropriations Bill, conscious that the ever-increasing uncertainty, sir, globally has certainly had a significant impact in terms of the government's ability to respond. But let me just, at the outset, sir, provide just some context in why we are here to do this second reading. And given the examination that has gone through with respect to the various heads that would have gone into the well, I want, through you, sir, to give the country the absolute assurance, sir, that the government of Barbados, within the context of the Barbados Economic Recovery and Transformation Program, having come to office, sir, just short of 22 months ago, has started and embarked, sir, on an ambitious program for the Barbados economy to recover. But we have always been conscious, sir, that given what we came into office and found, sir, we set in train a series of policy interventions, sir, which were designed to respond to the state of Barbados' economy as we found it, sir, in May of 2018. But as I stand before you this morning, sir, and I just want to, again, impress upon all within earshot, sir, that the government has not relented in any way, sir, with respect to our ability to stay on top of the situation. And I'm going to take the time, sir, to walk through what has been done and what the government will continue to do, sir, because under the circumstances that now confront not just Barbados, sir, but certainly the globe, that as representatives of the people, as the government, sir, that we must mobilize and work with all of the various stakeholders, sir, in order to ensure that, one, we keep Barbados as safe as we can, that Barbadians, sir, respond to the various public notifications, sir, and that we make whatever resources we have available, sir, to bring to bear to remedy the response to COVID-19, that we do so, sir, in an orderly fashion. Now, sir, when these estimates were being prepared, we started, certainly in the Ministry of Finance, sir, the officers would have gone out to the various ministries November, December. And as you know, sir, the first cases of COVID started in China in December of 2019. But as we went through this process, sir, over the last 3 months, the government has always had its eye with respect to what was emerging in China. And indeed, sir, I want to say, for the public record, sir, and for the benefit of all within earshot, that the Ministry of Health and Wellness, sir, has been on top and tracking the progress with respect to COVID-19. They have been preparing, sir, and implementing the plans required to be able to protect Barbadians and visitors who come to Barbados. And I really want to thank the honourable member for the City of Bridgetown, sir, and his team, because since the beginning of January, sir, one, they have not only been issuing public notification about corona, but it has also been sensitizing, sir, the various stakeholders with respect to how, sir, to protect themselves. Of course, since I last spoke in this chamber, sir, last week when we were doing the very supplementary, which was to make provision, sir, for the quarantine and isolation centers with respect to the naval base in St. Lucie, last Monday, on Tuesday, the World Health Organization, sir, declared that COVID-19 was now a global pandemic. And therefore, as that announcement was made, a lot more citizens started to pay attention because in the last week, certainly a number of CARICOM countries have reported cases, confirmed cases of COVID-19 or novel coronavirus within their jurisdiction. And therefore, Barbadians over the last week, sir, noticing the acceleration with respect to the fact that the virus had reached the region, people are now starting to respond and to pay attention. But the Ministry of Health, sir, has been for the last 3 months, since the outset with respect to novel coronavirus, sir, has been monitoring and has been preparing not just the facilities in Barbados, but certainly in preparing with the various stakeholders with respect to being able to manage the risk. Now, sir, I am not a health professional, but I know a little bit about statistics, sir. And in this scenario, it is important to, in a sense, sir, follow the science in terms of the response. But we have to provide context and to be able to manage this process, because it is critical, sir, critical that as people are now paying attention with respect to the impact that the coronavirus will have, not just in Barbados, but certainly globally, that the government, sir, is in a position to act, to respond to those natural fears that may develop from questions. But I know that the Ministry of Health, sir, and the officials within the Ministry of Health and the medical fraternity in the country will be more than able, sir, to manage this situation. But the reality is, sir, that the declaration of a global pandemic, which was inevitable given, one, the acceleration of cases and development within China, the rapid expansion, sir, across Europe, and we are now seeing, obviously, within the Americas, you are seeing an acceleration, sir, with respect to cases in North America, sir, reaching, as I just said, sir, with some of our neighbors. And it is important, sir, that we remind Barbadians first that there are clear protocols with respect to being able to manage and mitigate against the spread of the virus. And it is important that for persons to understand that the Ministry of Health, sir, and I want to stress that the Ministry of Health has been screening individuals who, upon entry to Barbados, sir, certainly in the first instance where it was determined that persons had arrived from China, sir, initially, and they say persons were arriving from China because we all know, sir, that we have hundreds of public servants who over the course of their normal workload will go to China for training. Other Barbadians go to China for business, sir, on a normal basis, as well as other business persons, that the Ministry of Health, sir, has been screening persons initially who would have had, obviously, a recent history of travel to China, because this is where the outbreak started. And therefore, the initial screening with respect to persons coming in had started, sir. And it is important that the public understands that with each stage of this process, that the government was just obviously ramping up, sir, the capacity within which we wanted to be capable of responding to the crisis. And as the Ministry of Health initially, sir, and I start here so that persons get an understanding that the government of Barbados, through the Ministry of Health and Wellness, has been screening persons coming from initially, sir, those countries who had travel history from those countries where the epidemic, sir, now pandemic, was most apparent, starting with those with travels history to China. And within those persons, sir, in terms of the screening, and the testing, or should I say the screening, self-isolation, and testing, sir, that to date none of the persons for whom had come into Barbados and had gone through that process have tested positive for novel coronavirus. But it is important for persons to understand, sir, that at this stage where it has been declared a global pandemic, that whilst the health protocols, sir, have to be followed, that the focus of the government, sir, has been to ensure that we can protect our primary healthcare institutions, because as people go about their normal business, sir, people get sick every day, normally, and they seek, obviously, care through either the polyclinic system or through the GP system or even the Queen Elizabeth Hospital, sir. And so the government strategy has been, sir, to build capacity outside of the polyclinic system, outside of the QEH, sir, such that the persons who have to rely on those critical healthcare institutions, sir, can do so in a way that their normal healthcare delivery, sir, is not compromised. And therefore, we have started the preparation, sir, with respect to not just the added facility at the Old Naval Base in St. Lucie, but also the Elaine Canterbury Center in St. Lucie, to be able to build capacity. Why is this important, sir? The government believes, sir, quite frankly, that the protocols through which, as I said, taking a risk-based approach to this process allows for us, sir, to be capable of isolating if in the event that there is a positive result with respect to coronavirus, that the isolation as well as the quarantine facilities outside of the normal healthcare facilities will be critical, sir, first and foremost to containing any further spread of the disease, because once you are contained within the 14-day period, sir, then we are confident that we will be capable of minimizing the impact in terms of community spread with respect to coronavirus. This is important so that persons understand, sir, that the protocols to follow are critical. Now, sir, I know that in the normal scheme of things, we feel unwell and we go to the doctor. And that is normal, sir. But in this instance, as the medical professionals have indicated, the process now, sir, is with respect to the symptoms of novel coronavirus, high fever, the cough, the sneezing, what have you, sir, is that you call either your GP or you call the health hotline, which is 536-4500, sir, such that you're given advice, sir, in terms of what to do or where to go. And again, sir, this is important for the public to understand, because it is critical that irrespective of whether or not, sir, any subsequent screening or testing may prove to be either negative, and we hope that the test remain negative. But even if the test becomes positive, sir, it is important that people understand the protocol that is required and that we follow the protocol to the letter in order to protect our friends, our families, the people we work with, sir, our communities. This is important. And as we are here today, sir, to do this very a constitutional requirement in terms of passing this budget for next year, I am conscious, sir, that in an environment where we now have to manage not just a potential public health crisis, and I will go on further, sir, to speak to the wider aspects with respect to how our lives may or may not change over the course of the remainder of this year, it is critical that we first and foremost, as citizens, understand what is required of us, sir, in this moment with respect to being able to respond responsibly in the current scenario. And so I'm taking the time, sir, just to articulate through you, sir, for the benefit of the public, that it is absolutely important, sir, that the protocol with respect to the coronavirus is followed by every single Barbadian and followed by every single visitor to this country. And it is at that point, sir, I want to say to people that while social media is a very important tool for disseminating information, that it is critical, sir, at this juncture, that as citizens, that we display a level of responsibility in what kind of information we share, and that to trust the sources of information coming from the Ministry of Health and Wellness, sir, through the Barbados Government Information Service and the various media houses that we have partnered with, sir, to ensure that the messages with respect to what needs to be done is done. Because at the end of the day, sir, at the end of the day, it is our responsibility, not just as government, but certainly as citizens of this country, sir, to ensure that we help protect those among us who, one, may be particularly exposed because of any underlying conditions that persons may have. And we know, sir, that we are a society that the non-communicable diseases, sir, are quite prevalent. And therefore, for that reason alone, sir, it means that we have to make sure that the information that is shared is as clear as possible so that people know what to do, when to do it, sir, how to do it, in order to help protect not just your family, but certainly those for whom you may come in contact with over time. And the truth is, sir, this is the only way that the government and the people of Barbados can respond with respect to a crisis such as this. And therefore, it is important that persons take the time, sir, take the time to think through what it is they're circulating and ask themselves, of what benefit is this to the people I am sending it to? Now, let me just say, sir, that it is important that as we have now reached a stage where there is a global pandemic declared with respect to COVID-19, and I will refer specifically, sir, there were some videos circulating to with respect to an ambulance at the DV South Winds. And whilst the narrative with respect to the person taking the video of the ambulance taking the person in the mask from DV South Windsor, it is important that people understand what they were seeing, because whilst the video or the intent perhaps of the video was to suggest that there was corona virus in Barbados, I want to reiterate, sir, that what person saw on the video was in fact the protocol that is required to be followed. Because, sir, if you present with coronavirus, it could be at DV South Wind, sir, it could be anywhere in Barbados. The protocol is to call, sir, the hotline, 536-4500, sir. Get the advice from the medical professionals on the other line. The ambulance, sir, will be dispatched to you rather than you go into, because as I said, sir, the normal thing is to go into the doctor's office. But the protocol is, sir, that the ambulance will be dispatched to you, in this instance, such that we have the capacity, sir, to contain, first and foremost. But at that stage, sir, the medical professionals don't know whether you are positive or negative with respect to the coronavirus. And therefore, the protocol is in place, first and foremost, to ensure that we can protect people in the event, sir, that the test actually turns out to be positive. And so therefore, as I said, sir, since the beginning of the year, the officials of the Ministry of Health and Wellness, sir, have been screening persons in Barbados with respect to coronavirus. Persons have actually, sir, been in self-isolation, sir, and I want to thank those persons who, with the discipline and responsibility that's required, understanding, sir, that if you feel as if you have been exposed and you go into self-isolation, sir, for 14 days, that the responsible thing, sir, is to ensure that you do that and see it through with respect to that. So I want to thank them, sir, for allowing the process to go through. But the process with respect to the protocol, sir, and I come back to this, is that what person saw on the video was the way the protocol is supposed to be followed. So people at this stage, sir, there ought not to be any notion of a rumor that it here or it ain't here. The reality is, sir, that as travel, certainly as a tourism-dependent economy, sir, and I just want to say, sir, that it's not only tourists that travel to Barbados. Barbadians travel to Barbados, sir. Whether for business, I know that this year is the year of the gathering, and so therefore the issue in of itself isn't the travel, sir. The issue is where have persons come from, on the one hand, or where they've been to, because Barbadians travel for all kinds of reasons, sir, from here. And therefore, the Ministry of Health and Wellness, sir, in conducting their surveillance with respect to tracking and monitoring where people have gone, what they might have been exposed to, and as we know, we have gathered information, sir, with respect to the progression, with respect to the development of the virus, that we have to, yes, assess the risk, simply because, sir, the only way that you can have a measured and a reasoned response to be capable of containing something like this, sir, is to ensure that those persons who potentially, sir, might have been at risk are the ones that you're screening first, isolating, before, obviously, sir, going back into the rest of the normal population. And so the government of Barbados, sir, has been screening. Persons have been in self-isolation with respect to being able to monitor this, as we have been building additional capacity, sir, additional both isolation and quarantine facilities, such that we are in a position, sir, to respond in the event, sir, that the numbers escalate within the context of Barbados, that we have sufficient facilities set aside for isolation to determine whether or not persons will eventually present with the symptoms of corona, or if they do someone eventually, sir, test positive for corona, that they can be put into quarantine with respect to being able to help further contain potential spread of the virus. And sir, that is a reasoned and reasonable response to ensure that we maintain, sir, the integrity of the full healthcare system, because as I said, sir, we are a population with a very high non-communicable disease prevalence, and therefore people need to access care within the normal healthcare system on a daily basis, weekly basis, depending on the severity of the underlying condition, whether it's diabetes, hypertension, sir, and the like, heart disease, and these other non-communicable diseases, sir. And therefore, that has been our strategy, sir, to ensure that whatever happens, sir, that the government and the people of Barbados can maintain as far as possible, sir, as far as possible, a sense of normalcy with respect to how we provide health care to the citizens of Barbados. And so it is important, sir, that when people see these activities taking place, it is to reinforce that what persons saw on the video at DV South Windsor should reassure persons that the protocol is working. People are following the protocol. And the fact, sir, that yes, tests would have been done, because once it's reached that stage, sir, and the ambulance has taken you away, sir, you would have been tested. And therefore, if, sir, and when there is a positive result with respect to the testing for a novel coronavirus, then that, sir, will be announced to the country. But here's what is important, sir. Not just that the announcement is made, but I want to reiterate that what the Ministry of Health does as well, sir, once someone is suspected of being exposed to the COVID-19, is that they do something called contact tracing, sir. So they want to know from you, sir, within the last few days, who you might have interacted with. And so for the benefit of the public, sir, I want to use this opportunity to remind Barbadians that whilst there's a lot of information going on in the public domain with respect to whether it is here or not, what is critical for the average person in Barbados, sir, within earshot of my voice, is yes, we have gone about our business, sir. The government has responded by being able to build capacity, as I said. But it is important that people not miss the boat, so to speak, sir, with the very basic and essential things that we must now be doing. Now, the truth is, sir, Barbadians have always washed their hands, and I think that's something that we should be very proud of. But it is now time, sir, to ensure that we do so with even more, not just frequency, but certainly, sir, with more fervor. Because the number of times that we touch our faces, sir, it is something that we don't even recognize how regularly we do it. So the simple message coming from the officials of the Ministry of Health is to wash your hands frequently. Now, there are fears, and I know that certainly, sir, that the natural response from persons, especially those persons who are on the front line, and I know there have been calls with respect to the protection of persons on the front line. And certainly, sir, the government of Barbados, throughout this process, the officials, certainly from the Ministry of Health, sir, have been and continue to engage those persons, certainly on the front line, those persons who have to interface with large numbers of people, and those consultations, sir, certainly will be expanded with respect to engaging those persons in terms of what they are actually at risk for. And it is natural, sir, it is natural for persons to want to wear gloves. It is natural for persons to want to wear masks. And the truth is, sir, it is something that really and truly makes us feel as if we are protected. That is the truth. It makes us feel as if we are protected. And it sounds, sir, counterintuitive for the person listening, because once I put on gloves and a mask, sir, I instinctively feel as if I am being protected from what is out there. It makes us feel protected. But the truth is, sir, the truth is, what really ought to happen, given what the doctors and the medical professionals know about the virus, is that the virus is spread by coughing and sneezing. So therefore, the droplets that you emit, sir, when you're coughing and sneezing gets onto the surfaces around you or onto people, and that is how the virus spreads. Now, sir, so let's think it through. Now, whilst I know people are free, sir, certainly to take their own personal protection that they may wish to engage in, and that is, so the government isn't saying to people, don't do this, but we are saying that there's a risk with respect to the use of gloves and the use of masks, that whilst we may feel as if we are protected, how we use them is much more important, sir, than if we use them. Now, the truth is, sir, as I have sought to engage my constituents on a daily basis in the use of these things, and I hope that people have been comforted, so long as they follow the protocol as I mentioned, sir. The reality is that if you feel that you have been exposed to corona, sir, and you're coughing, you're sneezing, you have the fever, and all of that, then you are probably the person that should have the mask on, not me. If it gets to a stage, sir, where the virus spreads across our community, sir, and we have to care for a loved one, then if you are caring for a loved one who has corona, when you're in the room with the person, sir, you're the one then to wear the mask to potentially protect, because obviously the person will be coughing and spewing. So therefore, if you're caring for an individual, you should be the one wearing the mask in the room whilst you're caring for them at that stage. Now, sir, this is why it's important for people to understand that the wearing of the mask and the gloves, sir, really should be limited to those circumstances. Because if I feel that putting on the mask and the gloves, sir, protects me, and I go all around the parliament, sir, and I touch up the whole parliament, sir, and I do all the things that I will do in a normal course of business, then in effect, sir, I could potentially be spreading the very virus that I think that I am protected from. Because as you know, sir, we touch our face, we touch our nose, we touch everything, sir. So therefore, sir, if you are going to take the opportunity to use a mask or to use gloves, then you still have to practice, sir, the proper hand hygiene, because that is critical, sir, to ensuring that we can first contain this thing. And the truth is, sir, this is what the medical professionals, sir, having engaged certainly the various stakeholders, have continued to say to persons. I know that persons will instinctively feel that because I have on gloves or I have on a mask, that I feel safe. But I'm saying to persons, sir, if you choose to wear gloves, if you choose to wear a mask, sir, then you have to be very conscious of what you do when you move away from the immediacy of, as I said, if you happen to be taking care of somebody who has been exposed to corona, when that comes, that is quite appropriate for that point. But what we have to reinforce, sir, is that we do not want people to have that false sense of security and then end up, sir, through an improper use of the very things, end up then helping eventually to aid and abet the spreading with respect to the virus. So it is important, sir, that we continue to reinforce, sir, that the health protocols that we are following, sir, they not just start last week when the WHO declared this a global pandemic. And therefore, the government of Barbados, in seeking to ensure that we have the adequate resources to respond to this, we have done what we have done so far, sir, as I said, focusing first on those persons who might have traveled from specific countries in the first instance, and this was happening since January, sir. Since January. Persons have now gotten, since the declaration of the pandemic, everybody now is in tune to it, and would have, in a sense, sir, missed a number of, some people, might have missed a lot of the engagement that the Ministry of Health and Wellness would have had engaged in consultations and public notifications and information about coronavirus since the beginning of the year. And therefore, know that it is here meaning a global pandemic, sir, not here in Barbados, a global pandemic, that Barbados now finds itself in a position, sir, where now it is not just the potential impact, public health impact for the population, but we are also now faced, sir, with a situation where the entire global landscape has changed for 2020 significantly from when we started this process with the estimates in January with the Ministry of Finance, bringing in the ministries with respect to arriving at the numbers that we just passed in the appropriation bill. And so the landscape having changed drastically, sir, drastically, my job here today, sir, is simply to prime this chamber and this country, sir, for the fact that this government, working certainly with the Ministry of Health and Wellness, we have been monitoring, sir, the progression of COVID-19 and certainly the spread, sir, the spread globally. It is now declared, sir, as I said, a global pandemic, and therefore this was the immediate focus of Barbadians will be on the public health, obviously, issue, sir, because one death is too many, sir. One death is too many. Whilst there is a potential public health crisis on our hands, the reality is that we have started, sir, already to feel, in a sense, sir, the impact of the fact that because it is a global pandemic, it has changed the entire trajectory from all the assumptions that we would have made going into this process, that in a real sense, sir, we have to recalibrate. And that recalibration, sir, is still ongoing. Yesterday, sir, and at this point, let me just say that yesterday, the CARICOM finance ministers, sir, met in a special meeting of the Council for Finance and Planning, sir, which is an organ of CSME. And we were discussing, sir, all the finance ministers from across the region, sir, and their officials were discussing, sir, the potential impact that it would have, sir, on their economies, sir. We also discussed what would be the possible response that we would have as a region, sir, in order to mitigate against what will clearly, sir, be a significant downturn if this pandemic persists beyond this year. And the reality, sir, is that irrespective of, at this stage, whilst the going assumption is from what is being said that it is likely that there will be a vaccine at some point, perhaps later this year, as a best case. The reality is that because a lot of our economies, sir, are tourism dependent, and certainly as Europe and the Americas now, sir, become much more in focus with respect to the spread of the pandemic, that the impact that is going to have on the economies in the Caribbean, certainly over the next 6 months, will be significant. And therefore, we have to be in a position to respond to that. Now, of course, sir, the reality is that with the announcement of of travel bans by various countries, the announcement, sir, or the impact that the impact of the slowdown in manufacturing of certain key, of just manufacturing in general, but certainly, sir, certain key, certainly pharmaceuticals and the manufacturing process globally with the impact of COVID-19, then it means, sir, that for us, certainly in the region and definitely in Barbados, that we as small open economies now, sir, are much more, in a sense, exposed, because whilst the reduction in tourist arrivals will be the immediate, sir, impact being felt regionally, it is the wider impact with respect to the global logistics supply and the global supply chain, sir, that is going to have a much broader impact on all of our economies, and certainly here in Barbados. And that is where, sir, we as a government, working in concert with our colleagues across the region, we now, sir, have to be in a position to see how best we can respond to, in the very, very, very shortest possible time, sir, boost a number of areas of domestic production, not just in agriculture, but also potentially manufacturing. Conscious, sir, conscious that we do not know at this point whether, as we know it, whether shipping arrangements will continue in the way that they have so far, given that, one, airlines have started looking at obviously closing flights, less people are traveling, and it will speak to some of those assumptions with respect to that, sir. And the truth is, we have to prepare ourselves, sir, to dig deep if this pandemic, sir, continues beyond the next 6 months. The next 6 months will be a challenge, But we have to prepare ourselves, sir, not beyond that 6 months period, with respect to being able to ensure that if there's a short recovery, sir, and I use the term short recovery being a 6 months, where things start to come back into place, where obviously it will operationally for a lot of the logistics globally, that if things can return to as close to normal September, October, that we have to be able to ride it out until then, and therefore we have to make certain adjustments internally to be able to do that. Now, the truth is, sir, that this afternoon at 3 p.m., and I was just watching the clock for the time, that this afternoon at 3 p.m., sir, we will be having a meeting with the International Monetary Fund, because as you know, sir, Barbados is in the Barbados Economic Recovery and Transformation Program, which is supported by an extended fund facility by the International Monetary Fund. And under that program, sir, as you well know, one of the key targets under the program is the 6% primary surplus. Now, I read today's newspaper with interest because there was much said about the 6% primary surplus. And the reality is, sir, that, and just to remind those through you, sir, that the government of Barbados coming to office, we didn't suddenly decide that we're going to run a 6% primary surplus because we wanted to run a 6% primary surplus, you know, sir. When we came to office, a lot of bills weren't being paid in this country by the government of Barbados. Business confidence and consumer confidence, sir, investor confidence was at its all-time low. And therefore, the interventions that we made, and then obviously the announcement with respect to the debt restructuring, sir, has put us in a position where for the last since October 1st of 2018, sir, that between then until now, sir, that we have been able to start to pay down a lot of those arrears that were owed by government to individuals for tax, personal income tax, reverse tax credit, sir, VAT refunds, corporation tax, you name it, sir. Goods and services being supplied by small, medium, and large businesses to government, sir, that was not paid. So the concept of running a 6% primary surplus was to ensure that government, on the one hand, sir, having restructured its debt, could run its current affairs, which means, sir, that things like hand sanitizer could go back into schools and clinics across the country, sir. That toilet paper, sir, can be deployed into schools again, sir, rather than being rationed as they were in the past, sir. These very basic things, sir, that Barbadians now have gone out and bought in a very short order in terms of being able to, and again, sir, perceive preparedness with respect to this crisis. But the reality is, sir, that the 6% primary surplus, and as you know, sir, that was designed to respond to what we inherited from the last government. And we were on track, sir. Not we say we were, sorry, let me rephrase, sir. We have been on track with respect to being able to ensure that we meet those those fiscal targets in order to ensure that all of those refunds and stuff that were owed from the last administration, sir, that we are in a position to repay, and we are also paying our bills on time. Sir, we are no longer printing any money at the central bank, which threatens the exchange rate, sir, with respect to the 6% primary surplus. But as with everything, sir, as with everything, and just to indicate for my colleagues, my fellow economists, sir, colleagues, that of course the global pandemic was unforeseen. As a matter of fact, sir, 3 months ago, yes, about 3 months ago, because today is what, March 16th, sir? 3 months ago, if I recall, I think the first case was probably announced closer to Christmas, sir, of December 25th. So literally, sir, 3 months ago, but certainly, sir, at the beginning of December 2019, sir, nobody in the world, sir, nobody in the world knew anything about, well, I said knew anything. There was no presence of corona in the way that it is today. And therefore, the fact that it has been declared a global pandemic will obviously mean, sir, that we have to make adjustments as a government. Because as we have already said to the International Monetary Fund, sir, that you cannot fight corona with air. And therefore, the government has to build capacity and able to respond, first and foremost, to a public health crisis. And in the event, sir, that members, not I need to remind members, but you will recall, sir, that when we launched the Covenant of Hope to the people of Barbados, sir, that on page 26, we indicated that the first claim on public expenditure, sir, as I said last week, was to preserve law and order, but the second claim was maintaining public health. And to that extent, sir, we have already started discussions with respect to the International Monetary Fund, with respect to what we're going to do in this coming financial year, which, as I said, sir, the whole point of these estimates being laid in the chamber at this time was on the assumption, of course, when we started the process, that normal service would resume. And even whilst we were here in this chamber, sir, over the last few weeks, discussing the estimates as prepared, and as you know, sir, these estimates were laid in this Parliament February 18th of 2020. So that is just short of a month ago. So even during that process, sir, we were having discussions with the fund about what will be the government of Barbados' response once this thing called Corona was declared a global pandemic. And therefore, yes, it would appear that for those who are now talking because it has been declared a pandemic, that the government of Barbados has already started, sir, the work with respect to what a change will look like with respect to the budget of government. And therefore, we are in the process of negotiating with the fund how we will recalibrate, sir, the primary target. And as you know, sir, was at this stage, the government of Barbados, and I want to say to all Barbadians, to all investors, all business people, all consumers, sir, all citizens, all taxpayers, that the government of Barbados, sir, is still committed to achieving the 60% to GDP target, debt to GDP target by 2033. We are still committed to doing that. But however, in these circumstances, sir, with respect to being able to respond to a global pandemic, then we have to make adjustments now in the interests of Barbados, in the interests of ordinary Barbadians, sir, and therefore those discussions which will ensue. As I said, we have a meeting at 3 o'clock to, and it's not just us, it's the region, sir, because as you can appreciate, we are all exposed, we are all very much exposed, sir. And what is particularly worrisome as well, sir, as you well know, we are just about 3 months away from the hurricane season. And therefore, the potential, sir, the potential for any further disruption for Barbados or in the region, sir, given that there already is a global pandemic on the way, the potential for further disruption is there, and therefore we are looking at this not just as a specific response to COVID-19, but the fact that as small, open, and very vulnerable economies, that whilst large countries can take decisions to close borders and to ban travel and to do all of these things, we have to be as circumspect as we can, given, sir, that if the ordinary Barbadian goes into the larder, sir, if such things still exist, if they go in the larder or cupboard, sir, they will see that most of the items there, sir, are not made in Barbados. Most of our pharmaceuticals, sir, come from outside. And those pharmaceuticals, sir, have to get here somehow. And whether they get here by airplane, sir, or by ship, the reality is that in order for us, not just in Barbados, but in the Caribbean, sir, in the Caribbean, that we have to ensure that we still maintain an open window to the world, sir, with respect to being able to ensure that critical supply, sir, of key items can still come into the country. Because as I said, sir, part of our response has been to build capacity outside of the healthcare system such that the normal healthcare delivery can continue. But that normal healthcare delivery can only continue, sir, if we are still capable of accessing the normal supply of pharmaceuticals. Now, some time ago, sir, I heard on the news, I heard on the news that some countries were banning the exports of certain basic things like paracetamol. Now, if you can imagine, sir, you got a slight headache. Some people suffer with serious migraines and these things, sir, that whilst the drug service has moved, sir, to do an accelerated procurement to ensure that at least we can have 6 months of supply of just normal drugs, nothing at all to do with COVID-19, sir, in response to ensuring that at least the normal provisioning of healthcare can continue, then I want to say, sir, that this government has not taken this thing lightly at all. But we are still reliant, sir, on external factors in order to be capable, sir, of delivering that which we want to deliver for our people. And the reality is, sir, that we can't close ourselves off, as some may think is the appropriate response, because simply, sir, we don't produce a lot of the things that we require for our daily subsistence, sir. And the reality is we may do ourselves more harm, potentially, sir, potentially, by taking too hasty a decision without bearing in mind what will be the consequences with respect to being able to ensure that we can maintain some semblance of normalcy. And the truth is, sir, that this is going to be, it has been, it will continue to be for some time, sir, a very fluid situation with respect to how we are going to manage ourselves through this process, because it is absolutely critical, sir, that as the government has sought to engage not just the opposition, we have engaged members of the last administration, we've engaged the social partnership, sir, we have engaged and will continue the engagement with respect, excuse me, sir. We will continue to engage all of Barbados, sir, because this is the time that we now, sir, have to respond as one Barbados, sir, because this COVID-19 threat, sir, presents a unique opportunity. On the one hand, whilst there is clear uncertainty with respect to how it would pan out, it does present opportunities there for us to do things differently in this country, and those are some of the positive things that we would want to have done. And therefore, without, sir, persons descending into panic and fear, that the focus, as we see it now, sir, is to ensure that we do all that we can, sir, to prepare not just the infrastructure within the health system, but certainly prepare families and communities across the country to understand, sir, what to do, when to do it, sir, how to do it. Because it is critical that that message, sir, is carried across the length and breadth of this country, so that people will have more faith and more trust that the government of Barbados has been and will continue, sir, to ensure that we follow not just protocols, but we follow the right information, we follow the science, sir, with respect to being able to respond to this crisis. Now, sir, I've spent this time speaking in this way because I think it's important that, and I know that when I speak on the substantive economics, that some may get alarmed. But the reality of our circumstance, sir, is that how we manage ourselves through this with respect to not just policy, potential policy response from government, but how we manage in our day-to-day interactions, sir, with people, with institutions, sir, is just as important as any policy response that government may wish to consider for implementation in order to respond to this crisis. So I spent that time, sir, laying the foundation, and I will move on to another section which I want to speak on, because it is important for us to understand what we have. Now, sir, the Barbados, in a sense, sir, has a very, very rich and strong tradition, sir, in managing public health. And I know we don't talk about it a lot, but we do have a very rich tradition in managing public health. We perhaps take it for granted, sir, that within walking distance of most persons in the country, you can literally walk and go to a doctor. And that is something, sir, that is not necessarily the case the globe over. But most persons in Barbados can walk to a doctor, or with the taking of a bus, can get to a doctor relatively quickly. And so I want to speak to Barbadians now, sir, on how, not just government, sir, it's not just government, but how Barbados, sir, will respond or is responding with respect to our capacity to manage this thing. Now, sir, we took a briefing last week, Monday, with the Social Partnership. And we are fortunate, sir, as Barbados, to have available to us 2 Barbadians, sir, who were in Sierra Leone, sir, in 2015 and 16 in response to the Ebola crisis. 2 Barbadians, sir. One is Mr. Richard Carter, and the other is Mr. Hart, sir. But Mr. Hart specifically, during his intervention at the Social Partnership, sir, indicated to us that the area of Sierra Leone, sir, where he was stationed as the infection control professional, had about a population of 1 million people, sir, and 2 doctors. 1 million people, sir, and 2 doctors. Now, you would understand, sir, that when I tell you that most people in Barbados can walk within walking distance, has access to some medical facility for the most part, sir, littered across Barbados, that Mr. Hart reminded us last week, sir, that we have over 600 doctors in Barbados. Over 600 doctors in Barbados. So if you can imagine that we have over 600 doctors, plus, sir, the nurses in Barbados, that we have more than enough capacity as Barbadians, sir, to manage this crisis. And therefore, with that kind of capacity on island, sir, then we have, as Barbadians, to recognize that, one, yes, we have the capacity, but now what we must be capable of doing, sir, is ensuring that we follow the appropriate protocols in order to respond. So our issue now, sir, isn't not having enough doctors or not having enough necessarily nurses. And I know that there may be times that we may perceive as if there's a shortage of perhaps doctors or nurses as it relates to the public system. But the reality is we have capacity, sir, in this country to manage this particular response to this particular pandemic. Now, sir, we have to leverage that capacity, and therefore, in how we manage, sir, and deploy resources, sir, that will be critical to give ordinary Barbadians, sir, the assurance that if and when there is a positive case of coronavirus in Barbados, and that if, sir, all of us do the requisite contact tracing to be open and honest, sir, because the truth is, sir, if I felt ill this morning, sir, I should not have come to Parliament to potentially sneeze on the member for St. Michael South, or the member for St. Michael South Central, or the member for St. Michael Northwest. So we have to take that personal responsibility, sir, because I might, and the truth is, sir, I know that The fellas out by Kermit Shop, by the top of Thornbury Hill, sir, they love to line on a Monday and Tuesday night. But the truth is, sir, people now have to be responsible, because if you don't feel well, sir, you can't go and mix up with people in the way that you normally would. So that's one of the things that we have to be very conscious of, sir, with respect to how we respond as individuals. But the capacity to which I refer, sir, means that we have the capacity within the healthcare system to respond to this thing. But people now, sir, have to take that individual responsibility for ensuring that we do the right thing at the right time, sir, and we do it the right way. Because we don't want to find ourselves in a situation where we become complacent because I feel that I can't miss out on this. But because I really know that I should come to Parliament this morning, sir, and give this speech, that I then infect the whole Parliament, and then all of us, as we go canvassing, then go and infect the rest of the communities in Barbados. Because that would be irresponsible of me, sir, to do such. And therefore, I'm saying that citizens now must take not the advice being given by the medical professionals very, 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 very seriously. Because containment, sir, is the key. And therefore, if I know that I shook hands, which I know you shouldn't shake hands now these days, they're doing all kinds of funny things with your arm and your foot and things there, which I don't really get, but that's how people are greeting each other these days. But the reality is, sir, we have to make these social adjustments within the short term in order to ensure that we maintain good order in the country. But we have capacity, sir. We have capacity. Medically, we have capacity. We have built additional capacity within, as I said, those isolation, or our building, sorry, additional capacity within the isolation and the quarantine centers. And let me just say to you, sir, I was listening to the governor of New York recently, sir. And New York, sir, which has a population of about 8.5, almost 9 million people, sir, that in New York, they have about 600, what they call 600 critical care beds. 600 critical care beds in New York. So, of about 8, as I said, sir, 8, almost 9 million people for the most part. Now, you, sir, on any given day, we have about 300,000 people on the island, almost, give or take, sir. But 300,000 people on any given day on the island. Now, sir, when we reflect on the fact that outside of the 6 beds that are at the Enmore facility, and then you have about 20 odd within the QEH itself, our mission, as I said, sir, is to build capacity outside of those facilities, because our focus is to ensure that we protect the main healthcare facilities, because as people are normally ill, we want people to be capable of accessing that healthcare in the normal way. But between the facility at North Point, sir, and the Elaine Scanterbury Center, as well as Paragon, sir, Harrison Point, as well as the isolation facility at the Elaine Scanterbury Center. In addition, sir, to the Paragon facility, sir, as well as the BDF Field Hospital, sir. The BDF Field Hospital. We will have the capacity, sir, of being able to deal with somewhere between 120 and 160 beds, sir, capable of delivering such. Now, when we think about scale, sir, and I know that the public is very clearly very concerned. And we ought to be concerned, because with a global pandemic of this nature, sir, where it is alien for us, sir, it is alien in our minds for people to die of a cold. And therefore, it is quite, quite, it makes people quite concerned, sir, that something that is normal could end up with such fatalities. Now, sir, in tracking the progression of this pandemic, and I want to go back to, as I said, the fact that yes, New York has 600 beds. We are building capacity for up in the region between 120 to 160, sir, when we are finished. That when you talk about the relativity, sir, it is important to understand that the government is preparing to ensure that we can respond in a way that, as I said, allows for containment as much as possible, so long as people do what they are supposed to do, sir, when they're supposed to do it. Now, sir, when I last checked this morning, when I checked this morning, I want to say to you, when I checked this morning, China, sir, had 81,000, and I just refreshed the page, sir, 81,032 cases of coronavirus. 81,032. China's population, sir, is 1,437,767,000,000, I think 697 or 678, something like that, sir. Something like that. And the reason I am using that as an example is two reasons, sir. Given that it's a pandemic, one would expect that there will be waves with respect to what's happening with the trajectory. So it appears that over the last few weeks, sir, China would have contained the spread within there. So it got up to 80,000 very, 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 very quickly, but it has slowed. What we are now watching, sir, is that yes, as the pandemic obviously spreads to Europe and the Americas, what we are watching to see, sir, in terms of making our assessment is whether or not the cases in China with respect to a second wave or a third wave with respect to the evolution of how pandemics normally evolve, we are checking to see, sir, monitoring what happens in China with potentially a second or third wave and how those numbers progress so that we can start to understand what is the true, in a sense, the truest impact. So the reason I quoted those numbers to you, sir, just now, 81,032 cases over the 1.437767698 or whatever the number is. When I translate that proportion, sir, now the truth is, sir, 80,000 people is a lot of people, sir, and it makes your head grow when you think that 80,000 people can have something in one place, yeah? It makes your head grow. But I have to come back, sir, to think about, one, the population, the statistics. When I work that out, sir, and I apply that ratio of infected persons in China at the maximum, sir, over their population, and I work it back and apply it to 300,000 people in Barbados, so just roughly, sir, that tells me that based on that ratio, that 17 people in Barbados, if I use the population, would have it. Of course, that's not hard and fast, sir, but it just tells you things. Now, of course, sir, if we are successful, if and when cases of corona arrive in Barbados with the population, if we're able to contain it in those numbers, then, sir, we will be lucky, because it means that we would have built capacity, sir, sufficient capacity to be able to deal with that. So if, sir, if those numbers are right and there's no further second wave or third wave where we see increasing with respect to the numbers in China, and we can say that within some level of confidence, sir, that we could translate it, that we could limit it to less than 20 persons, then I think we would have, in a sense, sir, sufficiently contained, because with those kinds of numbers, we could do contact tracing very easily with those kinds of numbers and be able to deal with it. The reality is, though, sir, that depending on the fact that it's a dependent. The fact is, we have a large proportion of our population, as I said earlier, sir, that are predisposed to diabetes, hypertension, and these other cardiovascular disease, sir, these basic underlying conditions that puts a larger proportion of our population at risk simply because of the presence of those underlying conditions. And therefore, part of the reason why we are building that capacity, sir, as I said earlier, is because we understand the dynamic of how our population is in terms of the presence of the non-communicable diseases. Now, sir, we hope that it doesn't come here. We really do. But hope is not a strategy, sir. Hope is not a strategy. And therefore, the government has been responding, and we will continue to respond, sir. And as I said in this chamber last week, sir, we are in a position, just 22 months in taking office, sir, that we could respond to this matter, sir, in the way that we are responding now, simply because we took the very urgent decisions at the beginning of June of 2018, sir, to do what we had to do to first rescue this economy, sir, from certain economic doom and disaster. We have gone through a process where, sir, it has impacted a large number of Barbadians, because we asked persons, sir, to make sacrifices in order to put the country in a better position, sir. We have, as I said, been paying back a lot of the monies that were owed by the previous administration, sir. And the reality is that we have to continue that, but we must do so now, sir, conscious that there is a clear and present danger with respect to the stability of the broader economy, the stability of the regional economy, sir, the stability of the global economy, and therefore, in this, as we go through these series of interventions, certainly, sir, with the not just the International Monetary Fund, but also the other development partners, with respect to how we respond to this, I must say to you, sir, that the government of Barbados is in a position, sir, to effectively respond, because even as we currently anticipate, sir, with our reserves, sir, and the last time I spoke to you, sir, our reserves now is over $1.5 billion, and we anticipate that will be topped up shortly even more. But we have the capacity, sir, to be capable of responding. And the truth is, sir, that 2 years ago, sir, honestly speaking, 2 years ago, it would have been very difficult to respond the way that this government is responding with respect to this matter, and capable of responding, simply because, sir, one, there was no confidence in Barbados. Two, the government had lost its way with respect to the management of the public finances, sir. And the credibility that is required to be capable of going to people and say, look, this is what we want done, this is how we plan to do it, and this is how you will be paid, simply was not there, sir. And therefore, we are in a position now, sir, to respond in this way, because we took the decisions that we had to take in June of 2018, sir, to ensure that we first put the economy back on a stable trajectory. And now that we are here, we weren't looking for this, sir, but it has been thrust upon us. And as with everything that the Barbados Labour Party does, sir, we shall face it, sir, and we shall fix it. This is going to be a challenge, sir, and another challenge, as if we haven't been faced with challenges since we came to office. But Barbadians, sir, and I go back to this. Barbadians have to rise again to the occasion as we asked them to rise, sir, in May of 2018. We have to rise to the occasion. And therefore, in rising to the occasion, sir, with respect to how we manage ourselves, and that taking of personal responsibility, sir, is critical. And as I look across to the member for St. George South, I feel compelled, sir. I know that his ministry has been in the vanguard of dealing with what seems to be an unfortunate, sir, set of events with respect to the way some people may be conducting themselves. Now, sir, and let me just say this and give the context, because it is important for, in the same way that I spoke about most Barbadians being able, sir, within walking distance, can go to a doctor or drive to a doctor or take a bus to the doctor. The same is true, sir, of supermarket, shops, and those mini-marts, sir, that are littered across Barbados, which is part and parcel of the distribution of items. And in the same way that we speak to access to a health professional in that way, it is important that people understand, sir, that if you go and buy up all of the Lysol and everything at the mini-mart or the supermarket, sir, and I've heard reports, sir, of some persons seeking to resell because there's obviously a shortage, and there's a shortage in inverted commas, sir, then that puts people at risk. And as Barbadians, we can't operate like that, sir, at this particular time. And so, as I spoke earlier about the health facilities, I want to remind Barbadians that the reason that they got shops and mini-marts and even little bars and that sell a little soap and a little thing to help supplement, that is part of the distribution network that if, sir, disturbed, can exacerbate, sorry, sir, an issue, because people rely on being able to walk down to the shop if you need a little something, sir. Because if I can't get to the supermarket, because if it reaches a point, sir, where we have to curtail the movements of people in this country, people must still be capable, sir, of going to the little shop or the little mini-mart, sir, and be able to buy some soap or get some Clorox with respect to being able to ensure that they can keep their surroundings clean. And therefore, I can only urge Barbadians, sir, to be responsible at this time, because people should not have to be figuring out where they could get these things from, sir. It is not normal. And therefore, we cannot in any way, sir, in the same way as we are trying to build the capacity with respect to maintaining the integrity of the normal health system, whether it's your normal GP or the polyclinic or the QEH, the logistics supply in Barbados has to be maintained in the sense that if you go and buy up all these things and people got to be guessing as to where they could go and get soap, Clorox, sanitizer from, sir, then it defeats the purpose of having a distribution system. And therefore, I can only urge Barbadians to take a step back and think about what the actions that we are doing and what we are doing, what we could potentially be doing to our people, our families, our neighbors, sir, our co-workers, if people seek to stockpile and hoard, especially for reselling, to try to take advantage of a situation that clearly is unprecedented. And whilst I know that there's been reports of price gouging and the like, I know that the Ministry of Small Business has been monitoring progress with respect to that. It is something that the government clearly has undertaken that we, if required, we may have to reintroduce some measure of price control with respect to these things. But I urge Barbadians, sir, Barbadians, to not do those things that will potentially put the lives of our families and our friends and our co-workers or our colleagues at risk, because people feel that I can go around to all the little mini marts, sir, and buy up all the things in order to resell to people. It really is not Barbadian, sir. And I want to encourage Barbadians to do the right thing. But more importantly, sir, if there is to be an issue, a problem with respect to whether it's shipping, sir, because we are still at the mercy of shipping lines and the decisions that are being taken at a commercial level. We are still at the mercy, sir, of airlines with respect to commercial decisions. And as you know, sir, as I said earlier, airlines don't only bring people, they bring goods into the country. And therefore, we have to, as far as possible, not just as Barbados, but as a region, maintain, sir, as long as possible, access to trade routes and trade links until such time as we can find, as there's a vaccine with respect to being able to bring this global pandemic to an end. But as I said, sir, we are monitoring what's happening in China. Especially, I know that a lot of us know we are focusing on Europe and the Americas with respect to what is happening, given our direct travel links to those areas. But in the normal evolution of pandemic, sir, we are monitoring what's happening in China to determine what will be, given that they had it first, it has now spread to the Americas, sir, and therefore in order to be capable of truly determining the longer term impact, we are monitoring what's happening in China, and as you are seeing, Italy, South Korea, and Iran seem to be catching up collectively with China alone, and therefore we are monitoring to see if and when there is a second wave or a third wave, sir, with respect to the pandemic, in order to ensure that we plan for the long term. Because at the end of this, sir, the reality is, if we were to shut down everything in Barbados tonight, sir, everything in Barbados tonight, the question is, how long would we shut it down for, given all that is happening outside of Barbados? There may come a point in this episode, in this pandemic, sir, where we may very well have to shut down communities and shut down large gatherings and the like. But at the end of the day, sir, unless we start to build the internal capacity to, one, boost, which I know the Ministry of Agriculture has already started with respect to the acceleration of food production, and just for the record, sir, because there may be some that might be tempted to interpret the announcement of an accelerated food production plan as a response to COVID-19, I can say categorically, and I know the minister will speak in his own voice with respect to this, but I know that every member of the Cabinet of Barbados, and certainly his staff at the Ministry of Agriculture, will be able to say to all Barbadians that this government has put food security, which is why it is the Ministry of Agriculture and Food Security in its name, has been in clear focus since this government came to office. They have been planning with respect to how they were going to achieve it, but circumstances have reached a point where now the accelerated timeline now obviously has to be put in place. So this is not a plan for COVID-19. This has always been the mission of this Barbados Labour Party government, and the Ministry of Agriculture is going to ensure that it is done. But let me get back to the point, sir. Over the course of the next 6 months, we have certainly to increase local, not just local production of food, but certainly local manufacturing, where obviously that is capable to support some of the agricultural processing and manufacturing as it relates to the agricultural sector. But the reality is, sir, that Barbados is now going to have to, and whilst we are hoping for the best, sir, but we plan for the absolute worst. And therefore, it is likely, sir, that life as we know it may have to be adapted slightly, sir, with respect to what we eat, how we eat it, sir, how much we eat, with respect to a lot of these things. And so therefore, it is important, not just for the Ministry, sir, of Agriculture to engage the farmers, but a lot of the spaces that we have around us, sir, that potentially can be made arable. Person's going to have to respond and come on board, sir, to absolutely, sir, increase the food production in whatever space that we can use, because this is going to be part of the response for the government of Barbados to ensure that we can feed our people, sir, conscious that logistically the global supply chain could be disrupted, and if it is disrupted, then we have to be capable of feeding ourselves. We are already self-sufficient, sir, in chicken, but of course there's still some import component in a sense to that, and therefore we have to monitor that, sir, as a key protein, sir, for ordinary Barbadians going forward, because as with everything, sir, this is going to be a very, very, very serious going down as it relates to the potential impact of COVID-19 on not just the economy, but certainly on the lives of ordinary Barbadians. And so, sir, this is important for people to understand that we have capacity, yes. We have capacity. It is manageable given the number of healthcare professionals that we have in Barbados. And we are fortunate, sir, to have these numbers of healthcare professionals in the country to respond in this way. And therefore, it is incumbent upon all of us, sir, to ensure that we carry the messages to the citizens about what they can do, sir, to help in ensuring that we as a government and as a country respond as responsibly to this COVID-19 potential crisis. Now, sir, let me get to, I almost said in those few words, sir. Let me get to some of the hard economics, sir, in terms of what we are looking at in terms of the potential impact on the region. Now, sir, as you know, as I indicated earlier, a lot of our economies, and certainly Barbados is a tourism dependent economy. And based on our estimates, sir, about 40% of our GDP is pretty much linked to tourism. And so, as you are well aware, sir, with the announcements of various travel bans and certainly the protocols with respect to what's happening globally with air travel, the World Travel and Tourism Council, sir, has suggested that there will be as much as a 25% decline in travel for 2020, which, as you know, is about 3 months or so of decline in global travel. Now, sir, we are going into what we may refer to as the low season for tourism. And whilst that may not be the worst part of it, the reality is with the announcement of certainly travel bans, and when we look at the fact that, as I said earlier, Europe and the Americas, where we get a lot of our tourists from, that the shift in terms of growth of coronavirus numbers have shifted from China to these areas where we get most of our tourists from. The reality is that whilst the tourists may not be traveling over the next 3 months or 3 to 6 months, sir, we appreciate that there's a lag effect with respect to the recovery. And so therefore, whilst the travel market may be declined, what we are looking at effectively, sir, is that if over the next 3 to 6 months, sir, the increasing numbers in Europe and the Americas mean that more people are coming down with the coronavirus, it is spreading in the communities. Businesses in those locations, sir, are either closed or see diminished activity because of the impact of the virus, the logistics, in terms of the impact that it has on the global logistics and supply chain, that we anticipate that even though the virus may peak, and all of this is still very much contingent, as I said, sir, on the presence of a second or third wave with respect to the pandemic. It's prefaced on that even at the best case, sir, and we say that it is a sharp 3 month, absolute best case. That is a sharp 3 month exercise, that it was going to still take some time, sir, before the capacity of the airlift and all of these things start to come back. And therefore, it is our anticipation, sir, that we in Barbados will likely be impacted for the remainder, in a sense, of this year, for sure, simply because of the way that the lag effect that we will anticipate will happen because of the spill-on effects within those economies. And so, for us, whilst we will love this thing to be as short as possible and as minimal disruption, that is, we believe, our best case scenario, the reality is that the availability of a vaccine appears to be much longer than that. And so therefore, we are at a stage now, with respect to our planning, that we have to be, as I said, sir, we have to be as circumspect as possible. We have a number of policy options available to the government to try to mitigate against the decline in domestic activity by prioritizing or refocusing the government's, first of all, the government's public sector investment program, which the Prime Minister will articulate certainly some of those details at the closing, sir, of this debate. But Barbadians can rest assured, sir, that the government of Barbados is monitoring and engaging with all of the partners in order to ensure that we respond in the way that we need to respond. We have, as I said, the medical capacity to deal with the COVID virus, and therefore I'm asking through you, sir, that Barbadians continue to follow the health protocols. We are formulating, with respect to our engagements with the multilateral agencies, in terms of how we will decide on the response. Under normal circumstances, sir, you would have had a budget presentation for all intents and purposes with respect to the advancement of this second reading of the bill. And so I can say at this time, obviously, it's not the government's intention in any way, sir, to raise or levy any new taxes. And therefore, with the situation being as fluid as is, we are ensuring that we respond in the best way possible by first ensuring that we build the appropriate capacity within the health system such that we are capable, sir, of first and foremost containing any presence of coronavirus, COVID-19, in Barbados. But, sir, we have already started looking at what the potential fiscal stimulus package could look like. As I said, we will reprioritize some of our capital spending in order to ensure that the things that will reach as many people, given the anticipated reduction in tourist arrivals, what that will have with respect to the impact on the tourism sector and those firms and entities that engage with the tourism sector. We will look at what we can do with respect to working with the commercial banks across the region and having the discussion yesterday with the ministers of finance across the region. There's already engagement with respect to the banks regionally and how banks will respond to both individuals and businesses in the event, sir, that there is a prolonged impact with respect to the downturn of coronavirus. Excuse me. We are certainly, sir, seeking to ensure that where there is a follow on the one hand with respect to the downturn in tourist arrivals, that there is sufficient activity taking place locally, subject, sir, to obviously to the fact that we are still dependent on the in a sense, the shipping lines and the logistics to be capable of helping to sustain that we are in a position clearly to ensure that we ramp up, as I said earlier, not just domestic agriculture production, but that we work certainly within the context of CARICOM in order to ensure that we can at least move food and other items between us in the event, sir, that we have to do such. The truth is, sir, that at this stage, the global uncertainty is significant. And as we come to this chamber to do the appropriation bill, it would be remiss of us not to say to the country and certainly to the rest of the government that with the presence of COVID-19, our priorities will change. And whilst the appropriation bill as passed was what we were contemplating prior to this, that at some point in the very near future, when we get a better sense in terms of where things are heading, we may very well have to come back to the chamber to give specific announcements in terms of what we will do in terms of the budget process. Now, let me state, sir, that during this particular point in time, and as we have been preparing, a lot relies on time, sir, and I accept that there's process involved for certain things. Certainly, the Ministry of Health and Wellness, sir, in responding to the clear threat of COVID-19, has been engaging in a lot of, we have been expediting the procurement process with respect to a number of key items with respect to being able to respond to the health crisis. Now, just for the benefit of the public, sir, because I recall during one of these exchanges in the estimates, there was some question with respect to the arrival of the sanitation garbage compactors. But under the Financial Management or the Act, sir, Rule 239 exists to allow the government of Barbados in situations of urgency, sir, to be capable of procuring items which obviously is required in a circumstance where facing a situation where the global supply and logistics chain of certain key elements, materials, goods, sir, could be compromised, that the Ministry of Health certainly in responding to this crisis, could hardly have gone out there, sir, and put out a tender for 4 weeks or 6 weeks and allow people to reply to the tender and go through that process, which is what they would normally do in the normal procurement process. But in this scenario, in wanting to respond to not just the procurement of goods, but certainly the services with respect to being able to build the capacity with respect to the additional works that are being done to boost up the isolation and quarantine centers, that the procurement component on the use of Rule 239 to engage, to respond to the current crisis obviously is relevant, because you could hardly expect the government to go through a normal tender process for even something as simple, sir, as paracetamol, when people are announcing that they are no longer going to be exporting paracetamol. And therefore, in order to be capable, sir, of delivering and stockpiling as much drugs as they can to last for a 6-month period, that clearly you needed to be able to expedite that, given, as I said, sir, 3 months ago, certainly at the beginning of December, for sure, as we were all preparing for Christmas at that time, sir, that coronavirus was nowhere on the radar of anybody, certainly globally. And then obviously, as it has evolved into a global pandemic over the last 3 months, that certainly the Ministry of Health has had to respond to ensure that it protects the public health of Barbadians. And so the government will continue, sir, to do that which is required to be done to protect Barbadians. This appropriation bill that's before the chamber today, as I said, sir, is really a best case, absolute best case scenario with respect to what we would have been thinking at the start of this process. As it has evolved, we have made resources out of this year's budget already available to the Ministry of Health, the 2019-20 budget, to ensure that the Ministry of Health and Wellness is capable of responding immediately, sir, to prepare Barbados for the crisis. Where we need to boost more capacity, sir, those decisions will be taken, and the appropriate resources will be made available from the Ministry of Finance to be capable of ensuring that we are in a position to respond to the crisis. Now, sir, with all of this, we still say to Barbadians that we want to continue life as normal as we can continue life, as normal as we can continue it, sir, for as long as we can do so. But we still must be conscious, sir, that as we go about that we are conscious of the information, and we take heed of the information being provided to us by the healthcare professionals. We have to, in a sense, sir, monitor our own behavior. As I said, sir, the contact tracing is critical with respect to who we engage with. The truth is, sir, that this will test a lot of us. I was speaking to a few people, we've been saying to some of the elderly persons about avoiding contacts, sir, and avoiding gatherings. And as you know, our old people, sir, they will tell you that if they're to meet their maker, sir, through Corona, that they will go to church and they will continue to do what they're doing. And we will continue to message and engage persons, sir, to try to ensure that we protect as many lives as possible. But we don't want our old people, sir, to meet the Lord sooner than they need to. And I know that's what we say. The reality is that there's certain things that we can do because we want to have as many persons among us for as long as possible. And therefore, we encourage people. I know some of us are perhaps a little more stubborn than some, but the reality is that we have to protect ourselves. And if we can, whether the churches or the little groups that we have can conduct their services digitally, sir, and give the same level of solace, sir, that we can engage in our communities, then these are some of the adjustments that we have to make, sir, in order to ensure that we can adequately respond to what is clearly a danger to the population of Barbados. But as I said, sir, it is not just the fact that we have a large elderly population. It is also the fact that we have a large number of persons with underlying health conditions. And therefore, as we disseminate the information related to the protocol, sir, people will as a matter of course, will see a heightened response from certainly the medical officials with respect to how we go about the effective containment of this. And the truth is, sir, persons have to take that personal responsibility, because as much as I, sir, love to come to Parliament, if I can't make it because, sir, I have the cough and my fever is high, and the people of Christchurch Essential sent me here, I know that they will not want me to come to Parliament, sir, and expose the rest of the government. And then obviously we have issues with being able to ensure that we are able to cope. I know that we have a lot of persons for whom, whether they're policemen, the guards downstairs, sir, the people at the airport who are doing the screening, sir, the immigration officers, sir, the customs officers, the maids at the various institutions, sir. And the truth is that wherever you are within the spectrum of the role that we have to play, the truth is that all of us, sir, have a responsibility in being able to maintain a level of social cohesion throughout this process. And therefore I ask all Barbadians, sir, all Barbadians, that we have to follow the science, follow the protocol, sir, with respect to washing our hands. Let's do so as quickly, sir. Let's adopt the protocols, sir, as quickly as we can. Let's teach our children, especially, sir, about the importance of washing their hands regularly, because as you know, in our society, sir, one of the questions asked earlier in the session was the interaction between young people and old people. And the truth is, sir, that as we go about this particular passage with respect to the preparations for what is clearly a global pandemic, that the interactions within our homes, sir, the interactions within our communities between young people, older people, the practice of personal hygiene in terms of the hand washing is absolutely, absolutely critical, sir. And whilst it is important that that is done as one of the key elements, and let me reiterate, sir, that for those persons who wish to adopt or to use what may be referred to as protective personal equipment, that the adoption of proper hand hygiene will support any use of masks or the gloves. And it is important that we understand that because we instinctively, sir, unconsciously touch our face, touch our noses, we do all kinds of things with our hands, sir, that even though we may have gloves on, that we have to be conscious how we dispose of those gloves, where we touch with those gloves, so that whilst we may feel personally protected, that the spread with respect to where you're touching things could lead to an acceleration of the spread, or the potential acceleration, sorry, with respect to the spread of disease. So we have to teach our children, sir, how to wash their hands properly and more thoroughly, let me put it that way, sir. We have a habit of doing it, but we now have to just pay much more attention with respect to what we do. Yesterday, sir, just as a quick anecdote, my son was doing some painting. He was painting some rocks, and then he decided he was going to paint his hands. And so, you know, as we've been teaching him how to do the proper surgeon type wash, he came in and I went and he was going through the motions of, you know, doing the inside the hands and all of that, and the thumb and fingers and this kind of thing, and making sure that everything is done. When he was finished, because he had the paint all over his hand, probably took about 30 seconds or so for him to do all of that. But when he was finished, sir, he still had traces of the paint on all over his hand. So I was trying to explain to him, sir, that if this was the virus on his hands, that the paint that he was still seeing meant that we needed to go again with respect to that. The truth is, sir, the way that these things are sprayed, we have to be very, 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 very careful. And that is why it's important, sir, that if people listen to nothing else, sir, that they must ensure that they practice proper hand hygiene, irrespective of whether or not, sir, you wear gloves or not, or you wear masks or not, sir. You have to practice proper hand hygiene. And that is the message that must be consistently carried, and for persons to do that on a regular basis. Hand sanitizer, sir, again, if you're not close to water and soap, yes, you use the hand sanitizer, but if you have the option, wash your hands. Because washing the hands, sir, thoroughly is what will be one of the primary responses that will help us to contain the spread of this virus. And so, sir, I spoke in this way this morning, sir, with not a lot of economics or not a lot of numbers, because I want to give the country the assurance that the government will respond and has been responding by making the necessary financial resources available to build capacity in the first instance. The next phase, within the next few days, sir, as we conclude our negotiations with the International Monetary Fund and our other partners in terms of the capacity for other response, in terms of the main economic response, is what we are finalizing. And therefore, at this particular point in time, the government is absolutely committed to continue the engagement of all the stakeholders, from the ram shop owner, sir, to the supermarket owner, to the jet ski man, to the hotelier, because it is important that everybody understands, sir, that the government will only be capable of responding, sir, in the same way as we have done strategically in response to the public health threat, that data is required for the government to respond appropriately to the various sectors, so that in the rollout with respect to any particular fiscal stimulus, that we ensure that those key individuals and businesses, sir, businesses, and by business I mean the fact that, sir, if Barbados is to shut down, that will have an immediate impact on transportation, it will have an impact on schools, it will have an impact on people's incomes, it will have an impact on employment, sir. It has a far wider impact than just the fact that you decide that you can close the airport. And therefore, the reality is that whilst we are cognizant of the risk, the reason why we are insisting that the protocols be followed is that once persons follow the protocol, sir, it gives the country the best chance, sir, of having to go to that extreme. And therefore, if we don't have to go to that extreme with respect to closing everything down, then it gives us the ability for any fiscal response, any fiscal stimulus that we will bring to be successful, because persons would have understood, sir, that we have followed to the letter the health protocols within our communities, within our homes, that we are following those protocols, sir, because we do not want to expose any of the healthcare facilities, whether from a private doctor to a polyclinic to the QEH, and we want to be capable of separating the impact of COVID-19 from a public health perspective from the main healthcare facilities, such that we are capable of mounting the best possible response as a government. And so, sir, this is where this government is at the moment with respect to being able to respond to COVID-19. There will be more, and as I spoke earlier, sir, the Parliament to which the people sent us to, we have had to relocate in short order, and therefore, if the Parliament is to be reconvened, sir, in the dead of night, to be capable of ensuring that we can do that which is required lawfully to respond to the people, then we are prepared as a government, sir, to come back here at any time to say to the people of Barbados that this is what the government is prepared to be capable of doing to ensure that we can protect them and their families and their friends, their co-workers, whether you work in the public sector, whether you work in the private sector, because it is important that we act as one. And therefore, sir, this government will continue to monitor, as I said, sir, what is happening, not just in Europe and the Americas, but also what is happening in China with respect to determining whether or not there's a second or potential second or third wave of the pandemic, so that we can ensure that we give Barbadians the absolute best available information, so that any decision that we take with respect to potential closure is rooted in what makes sense for Barbados over the long term. I will reiterate, sir, that from a personal perspective, people will make decisions with respect to their own personal protection, but I say to all Barbadians, sir, that if you wish to wear a mask or you wish to wear gloves in whatever environment that you're working in, that to ensure that you practice, even more importantly, proper hand hygiene, because the incorrect use of gloves could, sir, potentially make matters worse with respect to the spread of the disease. And therefore, we will not stop people from doing that, but we just want people to be conscious that there are risks associated with the inappropriate use of those mechanisms. And so, sir, I want to say that I fully, sir, support the appropriation bill before the chamber, but as you know, sir, as I said, there will be changes with respect to the priorities of government going forward, and I would rely, sir, on yourself and the members of this chamber that at the appropriate time, when we need to come back to this space, to be capable of saying to the country what is the definitive position of government with respect to the announcement of the appropriate fiscal stimulus with respect to the anticipated outfall with respect to the COVID-19, that the country, having given us the mandate in May of 2018, we have engaged under the leadership of the Honorable Prime Minister all of the stakeholders to date, and we shall continue to reinforce those engagements and those messages and say to all Barbadians that the Ministry of Health and Wellness has been on top of this since the beginning of the year. They continue to be on top of it. We have the capacity, sir, to deal with COVID-19, and all that is required now is for all Barbadians, sir, all Barbadians, to do what the medical professionals say. Forget the fear-mongering on social media. You will see evidence of screening taking place, which should fill you with confidence that the protocols are indeed working, sir. If and when there is a positive case of COVID-19, that will be announced with respect to by the Ministry of Health. It will trigger another stage, and therefore then persons should be acutely aware as to what they're required to do at that juncture. And the Ministry of Health and Wellness, sir, will continue to talk with people through this. All of us, sir, have to talk with our various stakeholders in order to ensure that we carry the same message, sir, as the Ministry of Health and Wellness. And therefore, knowing that we can rely, sir, on Barbados' rich history of a strong public health infrastructure, and that the government of Barbados, sir, and with the Ministry of Finance, will not spare any money, sir, with respect to ensuring that we can protect the lives of Barbadians. And then similarly, sir, that once the appropriate fiscal measures are announced, that once we have been able to effectively contain or manage the public health element as it relates to COVID-19, that it will give any fiscal stimulus, sir, the best opportunity for success, simply because we've been able to contain any potential public health outbreak. And so, sir, with those few words, I beg to move that this bill be read a second time.
Thank you very much, sir.
Honorable Leader for Government Business.
Mr. Speaker, I beg to move that the sitting be suspended for lunch until 4 o'clock this afternoon. I second that, sir.
The question is that this honorable chamber be suspended until 4 p.m. today. All those honorable members in favor, please say aye. Those against, please say no. We think the ayes have it. This honorable chamber stands suspended until 4 p.m.